Hello everyone, welcome to the second video of autonomic pharmacology. In this video, we are going to discuss about basics for cholinergic or parasympathetic nervous system. We have seen in our previous video the parasympathetic nervous system is originated from cranial and sacral region. There are four cranial nerves that are 3, 7, 9, 10, and there are three sacral nerves. They are sacral 2, 3, 4, from which parasympathetic nervous system is originated. We have also seen that parasympathetic preganglionic fiber are larger and postganglionic fiber are shorter. We have also seen there the parasympathetic preganglionic fiber secretes acetylcholine and postganglionic fiber also secretes acetylcholine. As the name contains choline, this is also called cholinergic nervous system. We discussed earlier that the sweat gland is supplied by sympathetic thoracolumbar outflow, but they are the neurotransmitter. Both preganglionic and postganglionic are acetylcholine. So it is not under our parasympathetic nervous system. You must have to remember that. Now we are going to discuss how this acetylcholine is synthesized, released, and what are the fate of it, and which drugs can inhibit the synthesis or release of acetylcholine from this preganglionic nerve fiber. So for this we are going to zoom our parasympathetic ganglion. We can see this is our preganglionic nerve ending and this is our postganglionic nerve fiber beginning. At first, there is a transporter in the preganglionic nerve ending called choline uptaker. By this, choline is uptaken into the parasympathetic nerve ending. In nerve ending, choline binds with acetyl-CoA, which was previously present there, and forms acetylcholine. Then this acetylcholine enters into vesicle and is stored here. On proper stimulation, the acetylcholine is released in the synaptic cleft. After releasing in synaptic cleft, it has two fate. Either it will bind to postganglionic receptor or it will be metabolized by acetylcholine esterase enzyme and it will again turn into acetyl-CoA and choline. This choline is again uptaken by choline uptaker and this cycle runs again and again. So here we can utilize some drug. By our first drug, we will block this choline uptaker. The drug is known as hemicolinium. We can remember that if there was choline, it should be uptaken by the choline uptaker. But we have done hemi section of the choline. That's why choline is not at the situation of uptake. So hemicolinium is the choline uptaker inhibitor. So it will irreversibly stop the process of acetylcholine synthesis. That's why it is also called irreversible blocker of acetylcholine synthesis. Then our second drug will act on the vesicularization of acetylcholine. It will inhibit the entry of acetylcholine into the vesicle. The drug is known as besamicol. Here we can remember the action of the drug from its name. Besamine vesicle, I means inhibit and col mean acetylcholine. So besamicol inhibits the entry of acetylcholine into the vesicle. And our last drug here is botulinum toxin. Botulinum toxin inhibits the release of acetylcholine into the synaptic cleft. Among these three drugs, hemicolinium, besamicol, and botulinum toxin, only botulinum toxin got the clinical utility. Botulinum toxin is used in different clinical conditions. They mainly relieve spasm in different neurological conditions like spasm in stroke and spastic dysphonia. which will be produced due to a spasm of the muscle which produces voice. And the most important use of botulinum toxin right now is beauty treatment. The celebrities nowadays use botulinum toxin to get rid of age related facial wrinkles. These wrinkles are basically facial muscle spasm. So when the botulinum toxin is injected precisely at actual location, it can get rid of facial wrinkles, and the heroine or the celebrities doesn't get the older look by using this. Botulinum toxin is clinically also called as Botox. Now we need to know about the receptor on which acetylcholine binds. These receptors are mainly of two types. One is nicotinic type, another is muscarinic type. On nicotinic receptor, the acetylcholine binds and also nicotine can bind and stimulate the receptor. That's why it is also called nicotinic receptor. And on muscarinic receptor, acetylcholine bind and also an alkaloid which is produced from plants. Muscarine also works. That's why it is also called muscarinic receptor. So the nicotinic and muscarinic have further subdivision. Nicotinic receptor are further divided into an N type of receptor and an M type of receptor. So from previous picture we can show the location of the receptor. N type receptor are situated at the nerve fiber, and if we guess there is a muscle, there should be also a receptor. This receptor will be an M type of receptor on which acetylcholine will bind. So this is called an N type. N means nerve, and this is called an M type. M means muscle. So an N type receptor is located on nerve fiber and an M type receptor is located on muscle. So nicotinic receptor location we have done. Now there is muscarinic receptor. There are 5 type of muscarinic receptor: M1, M2, M3, M4 and M5. Here M4 and M5 are exclusively located in the central nervous system, not throughout the body. In fact, all of the nicotinic and muscarinic receptors are located in the central nervous system, but M4 and M5 are exclusively located in the central nervous system. So now we will know about the location of M1, M2 and M3 receptor. We will remember this by a trick. Think of our daily life. What we do. In our day-to-day life, we must eat food. So, at first, eat food. Then, if we have time, we will hear to our heart. What our heart says, we will do that thing. Then, hear to heart. And so, when our stomach is full and we can hear our heart, then we will do all other thing in the world. So, all other things comes then. So at first eat food, then hear to the heart, and all other things come next. The first line here contains eat food. So food is related with the stomach. So M1 receptor is located in the stomach. Actually, it is not really located on the parietal cell of the stomach. Rather, it is located on the ganglia which is near the gastric parietal cell, also known as gastric ganglia. The M3 receptor is directly located on the parietal cell, but in this chapter we do not need the information here. This information I will again explain in gastrointestinal pharmacology. And then we will hear to heart. So M2 receptor is located in the heart or myocardium, muscle of heart, and all other location contains M3. So what are the all other location? Bronchus, maybe gland, maybe urinary bladder, maybe pupil of eye, maybe gastrointestinal smooth muscle. Now we will recall the information from the previous video. In previous video we have said that parasympathetic nervous system inhibits the heart and stimulate all other organs. So on heart, if the M2 receptor is stimulated, there will be bradycardia, and all other location there should be stimulation. So if stomach M1 receptor is stimulated, there will be increased secretion in hydrochloric acid. And if G80 M3 receptor is stimulated, there will be increase in peristalsis. These two effects will help in our digestion. That's why parasympathetic or cholinergic nervous system is also called rest and digest system. If bronchus is stimulated, there is bronchoconstriction, which will cause asthma. If glandular M3 receptor is stimulated, there is increased water secretion of gland. And if the M3 receptor of urinary bladder is stimulated, there will be urinary urgency. If the pupil of eye is stimulated, there will be pupillary constriction, which is also known as meiosis. As constriction means smaller, meiosis is a smaller word, and dilation is larger word. So pupillary dilation means mydriasis. So that's enough for today. In our next video, we are going to discuss about cholinergic drugs. Thank you everyone.